Great impressions ensure well-fitting bonding trays. This video lays out steps to help ensure your cases are completed with excellence. 6 Month Smiles recommends using PVS material for your impressions to facilitate easy repouring if necessary. Picking an appropriate tray size can help to ensure clear margins. Make sure the lip fits over the anterior edge of the tray is not infringing on the tissue in the posterior, and you can accommodate back to the second molars. Once tray size is determined, make sure to place PVS adhesive on the trays. This will keep the impression material from pulling out of the trays upon extraction from the mouth. Bleeding the impression material prior to placing the tips ensures that the material will mix evenly. Make sure to check your material set time before taking impressions. In this example, a heavy body with a light body wash is being used. The tray should only be filled halfway to 3/4 full of material. When placing the trays, you want to make sure to pull out the patient's upper and lower lips so that the material will flow into the vestibule and capture the gingival margin. Impressions should have clear margins with no voids, pulls, burn-throughs, or tight tissue contact with teeth directly touching clean tray. These issues can occur when the tray is too small, the tray shifted before final set, or the tray was pulled out before the material completely set. Before taking the lower impression, ask the patient to raise their tongue to the roof of their mouth once the tray has been inserted into the mouth and prior to completing seating. Make sure to check your impressions closely before pouring or sending them to the 6 Month Smiles case processing facility. Any of these issues can hinder the timely completion of your case. There are many different model materials. Make sure you are mixing your product to specifications. Using a debubbler product before or while pouring can achieve a smoother model finish. When pouring your models, start from one side and allow the material to flow over to the other side, filling all of the anatomy of the model. Build up a base, making sure that it is not excessively large. There is no need to mount your models. Case processing does not use this technique when setting brackets. Pouring up your great impressions to get a clear and crisp model allows case processing to deliver a perfectly set case. Allow your models to fully set before pulling them out of the impression. When finished, models should have clear margins through to the first molar, no bubbles, pulls, excessive flash on teeth, or warping of teeth. Issues to look for before sending impressions or models to 6 Month Smiles case processing facility. Notice large voids in the facial surface of the lower anterior teeth, pulls, and the tight compression of tissue on the left side of the tray. The lower anterior teeth have no clear margin, and tooth number 21 has a large void at the gingival margin. Here we see a large void where tooth number 26 is. The unclear margin on the facial surface of the anterior teeth make this an impossible case to set. Excess flash on tooth number 26 is a result of a large void in the impression. Models with broken or severely chipped teeth cannot be repaired. They would need to be repoured. Excessive bubbles in the stone can cause teeth to break. Following these tips and techniques can assure a successful and timely return of your case. With a good impression, we can help you provide the best quality care for your patients.